We actually had Dr. Pirro explain to Tori, as well as all of you, what really happens when your doctor says the words, "You have melanoma."
When a patient first comes in with a mole on the skin, the first job is to see if it has any of the warning signs that suggest a melanoma, and if so, then we biopsy it. A qualified surgeon makes a nice little area around the mole like this, getting a segment of clean tissue. Once we've made a diagnosis of melanoma, we need to know how extensively it might be present throughout the body. The way we do that is with a CAT scan and a PET scan. The worst day of your life is hearing you have melanoma. The second worst day is hearing that it's spread to other organs. Here we see that the brain is studded with numerous white spots here, each one of these representing an area of melanoma, making it difficult to remove. What most people with melanoma are trying to avoid is being in this chair. This is the chair where you get chemotherapy. You often lose your hair, can become very sick. It lowers the immunity of the body. It has lots of complications. As an oncologist, I've seen the gruesome side of melanoma. It can be very disfiguring, requiring operations and radiation treatments that can be quite mutilating to parts of the body. So Tori, stop tanning. Realize that you can be beautiful with light skin. That's the skin that you were born with.
Dr. Orton, to touch on this really quickly, along with Dr. Pirro and Dr. Wu, I think young people don't realize that even if you get melanoma and Tori, it doesn't end up deadly, it can be absolutely disfiguring if it's on your face.
So disfiguring. And as Dr. Pirro mentioned, typically melanomas, they can grow this way, but they also like to grow vertically. And when that happens, we have to remove the tissue around it very often in a very large diameter. This can be really disfiguring, and in fact, I have pictures here that I want everybody to take a look at. A huge involved surgery that I had to do with flaps coming across the face to close a big defect as a result of skin cancer, the type of skin cancer that you will get if you continue to use the tanning salon.
And you know, this is a really important point for you, I think, Tori, because in all your pre-interviews, one of the things you kept saying is, you know, I'm not worried about dying, everyone's got to die of something. If it isn't dying that scares you, maybe mutilation will. Maybe the fact that, you know, you have to move these big divots of tumors, and that can be very disfiguring because you obviously want to look good, that's why you're tanning, right? And so why would you want to take a chance of not looking good from bad surgery?
Well, the mole on my arm actually really woke it up. I really didn't think that it would be cancerous at all. And that really shocked me because of what happened with my aunt.
So Tori, tell me that you don't want to tan anymore.
I really don't want to tan anymore. I really don't.
Well, we're going to follow up with you, okay? And I want to thank you for being so brave today.
Thank you.
And for stepping forward, because coming forward today, this is going to save you a lot of problems in the future. So thank you, and thank you all for joining us as well.
Thank you.